So we will be talking about the blood cancers. So blood cancers per se is a sort of a syndrome in itself. It's a disease basket in itself, and that comprises more than 100 different types of diseases. Broadly, if we speak, the blood cancers we consider to be divided into three main types. Most importantly, different type of leukemias. The second one is what we call as lymphomas, and the third one is what we call as multiple myelomas. Hi, welcome to the new episode. We continue our journey discussing about the cancer treatments which are available, the options which are there for the cancer patients. So with the today podcast, we welcome Dr. Meet Kumar, who's a hematologist, a blood disorder specialist, and a bone marrow transplant specialist. Thank you so much, Vishalji, for inviting me to your wonderful podcast, and I hope that we'll be learning and explaining a lot of things to the wonderful viewers. So I am Dr. Meet Kumar, and I am a hematologist, hemato-oncologist, and a bone marrow transplant physician. And the added degree that we add to our credit is something called as CAR T therapy specialist. So that's a new kid on the block. That means the newer treatment evolutions that we are seeing in the years to come is something called as CAR T therapy, and of course gene therapy. So we will be discussing about those fields as well in the relevant aspects, and of course it will be great to have a discussion today with Mr. Vishal. Let's talk about the blood cancer and what kind of blood cancers are there, and how do you identify them? Namaskar, Vishalji. So we will be talking about the blood cancers. So blood cancers per se is a sort of a syndrome in itself. It's a disease basket in itself, and that comprises more than 100 different types of diseases. Broadly, if we speak, the blood cancers we consider to be divided into three main types. Most importantly, different type of leukemias. The second one is what we call as lymphomas, and the third one is what we call as multiple myelomas. Within these also, leukemias can be either acute leukemias, they can be either chronic leukemias. Acute leukemias can further be subdivided into acute myeloid leukemia, acute lymphoid leukemia. Chronic leukemia can be divided into myeloproliferative neoplasm, chronic lymphoid leukemias. Similarly, lymphomas can be subdivided into Hodgkin's lymphoma, non-Hodgkin's lymphoma, and there are almost another type of lymphomas that are existent. And of course, the plasma cell neoplasms, that includes the multiple myeloma and Waldenstrom's macroglobulinemia. Okay. Now, with so many types of blood cancers which you have described, so how do you identify a patient? What are the tests basically required to diagnose cancer? See, like that's a very pertinent question in the sense that we are living in a world where WHO is shouting at us and telling us that by 2030, 1 in 9 people will be having any type of cancer. So if we are 50 people in a room, you can calculate maybe 5 or 7 people amongst those group of 50 people are expected to have a cancer, and that is essentially developing, growing, increasing day by day because of the lifestyle parameters. So when we talk about these things, that's an impactful message that we need to give to the society, what you need to be careful about, okay, in terms of identifying your disease, in terms of early identification of your possible cancer that may evolve in the coming few years. And with that perspective, when we see that how do we diagnose these cancers, right? See, when we talk about blood cancers in particular, the gateway to any type of blood disorders is a simple blood test called complete blood count, that is called as CBC. Almost 70 to 80% of the times, if any person for that matter has got any evidence of blood cancer, that will definitely show up in this blood test called CBC, complete blood count. So when in doubt, get a CBC done. If you have any symptoms that we shall be subsequently discussing about the symptoms, different symptoms and different presentations about different types of blood cancers, the gateway to those type of tests is complete blood count. Of course, if the blood CBC is showing something, or there is some other allied tests that are showing some fishy things, in that case, the next test that is required is to undergo a bone marrow test,
that is sufficient enough to diagnose a leukemia or a multiple myeloma. In cases of lymphoma, however, more likely the diagnosis is to come by a test called lymph node biopsy. So there is a misconception that most of the times, if you go to some sort of rural area, if there is swelling in the neck that we technically call as a lymph node swelling, most of the times the rural practice is that they get a FNAC done if at all required, and that most of the times misses the diagnosis of lymphoma. So one very clear message that I want to give here is, if you have a cervical swelling, if you are swelling in the neck, in the armpits, in the inguinal areas, get a lymph node biopsy done. Maybe a FNAC, that is a fine needle aspiration, might not be sufficient to pick up a dreaded disease like lymphoma that, of course, in 2025 that we are talking is curable.
Right. So, doctor, you said CBC. The CBC is a very common test which can be done worldwide easily, even in the remote areas. People do it. And do you think, as per you, is it a lifestyle disorder, or is it something to do with the heredity, or what are your inputs on that?
See, if when we talk about blood cancers, I think what we need to understand, I'll tell you very briefly the origins of the blood cancers. So it's something very interesting. 1832, first time Thomas Hodgkin, who was an American scientist but studying in Africa, he could diagnose a disease called lymphoma. After him, it was named as Hodgkin lymphoma because his full name was Thomas Hodgkin.
Okay.
So the first time in 1830s, this diagnosis of Hodgkin lymphoma was made. Subsequently, most of the diagnosis subsequently being done in the US were leukemias. Early 40s, 1840s, 1850s was the time when the diagnosis of acute leukemias and subsequently multiple myelomas were diagnosed. At that time, as we sort of understand from the history, the treatments that have evolved over the times have essentially come into practice more so situationally. For example, the negative aspects of the world led to good treatments. For example, in World War I, during the World War I, nitrogen mustard was used as a weapon against the sort of enemies. But that nitrogen mustard, when it was used, what was discovered by the scientists, that this nitrogen mustard, when used in a lower quantities, can be used to treat different type of blood cancers. Subsequently came the World War II, 1940s, and that time the nuclear bombing on the Hiroshima, the Nagasaki, we all are aware about that. But what that sort of gave insights, the scientists what learned from those incidents was, if the radiation damage can be harnessed to medical advantage. That means if the radiation can be used in very lower doses, these can be used to treat and sort of cure permanently certain types of blood cancers. So negative aspects of the world leading to some positivity in terms of treatments is how the treatments for different types of blood cancers have evolved. And of course, now we are living in 2025. Over the last 30 years, the pace at which the treatments have evolved have never evolved that fast and that steadfast. So the number of treatments that are available, you'll be shocked to know that at present, there are almost 250 molecules that are in pipeline to come into the market for different types of blood cancers. So blood cancers, in a sense, is supposedly the most sort of researched type of cancer globally, because the success stories in the past for different types of blood cancers have been phenomenal.
So it's like you give an example of what has been discovered in if things can be used, how the things can be used medical purpose also. Similar way how we recently seen in pandemic, and things have gone wrong worldwide. The people have learned about hand hygiene, the social distancing, and how things can be.
Absolutely.
So it's and the patient themselves got aware. We don't say patient, we say people also got themselves aware about how to protect themselves.
Absolutely.
Which is
so necessity is the origin.
True.
For evolution.
True. So let's move forward now. Now we've been discussing about the type of blood cancer we have, but the most difficult part, as a doctor, I say, how do you give this message to a patient that he's been diagnosed with a blood cancer?
See, I would say in the entire journey, maybe treatment is not that difficult. The more important and the more difficult job for a good doctor is to handhold the family. That, of course, is a very difficult thing, but at the same time, a humane approach is what is needed. So, when we talk about humane approach, anyone can be diagnosed with a blood cancer. It's not that a certain person is more prone or the other person will never develop that type of disease in his entire life. But any person for that matter, every ninth person, if that is having a risk to develop cancer, that means any person in this world is prone to develop a blood cancer. When diagnosed, do not panic is number one. Number two, of course, you have to listen to your doctor, what he's trying to tell you, understand the thing rather than in a panic mode. You have to be calm, composed, and patient to understand what are the things that are going to happen in terms of what diagnostic tests are going to take place on you. How are you going to arrive at yes, that this is my disease, and how the treatments are going to shape up. So the good part about 2025 is we have good information. I'm not saying that 2030 would be better, 2035 would be better, but at present, today, as we talk, we have got a lot of sort of tests that are available that can tell us today what are the chances of my blood cancer getting permanently cured. Today I can do the test and tell the patient that yes, there is 70% chance, there is 60% chance, there is 80% chance that the blood cancer can be permanently defeated.
Okay.
Of course, the tests that we are talking about, essentially the molecular tests, those tests tell us the aggressiveness of a particular type of blood cancer. If a particular type of blood cancer is more aggressive, the logical approach to such things is that we try to be more aggressive in terms of treatment. So that means these patients might be good candidates for not only chemotherapy but followed by a bone marrow transplant. On the other end, if the blood cancer, that whatever the diagnosis is made, it is on the lower spectrum or low risk disease, in that case what it implies in terms of treatment is those type of patients can be treated without intensive treatment, also essentially with the use of immunotherapy or what we call today as targeted therapy.
Okay. Now, doctor, now this is how you describe a patient about the disease. How does a family and a patient react after listening from a doctor after the investigation that done?
Yeah.
What are their reactions on that?
So of course, see, if I tell, for that matter, any person in this world, okay, you are in trouble, the natural reaction is, okay, they feel broken. Any person for that matter, not only cancer, if I meet an accident while going back,
Yeah.
I'll be broken, as simple as that. But at the same time, so there are phases of acceptance to a trauma, whether it's physical or emotional. During that time, it's crucial for the medical team to handhold not only the patient but the family, to explain the things to them very clearly and very transparently, make them understand that even if it is diagnosed, it is not that this type of disease is deadly or incurable. Hand-holding in a humane environment is what is required to take the family through that journey of the treatment of blood cancers.
Now, so I believe the family also plays a very important role in supporting the patient through,
Absolutely.
because a long journey. It's not
Absolutely.
something which is a few days of time that
Absolutely.
cured. It's a long
Absolutely.
journey.
Absolutely.
Lots of ups and downs. The patient feels low and sometimes. So the patient also has to feel positive, and the family has to support them, I guess.
Absolutely. The whole ecosystem. So
Right.
for example, when I am sitting on OPD, I have to tell someone the statement that I use for every family, we have to work as a unit. It does not mean that patient is separate, the family is separate, and the treating team is separate. So everyone has to act as a unit, common unit,
Right.
and then only the treatments delivered can be successful.
You spoke about a lot of things which was accidentally diagnosed in terms of getting treatment options for the patients. What are the current scenario with something latest technology, some latest research, which is helping, especially in the blood cancer patients?
See, I'll tell you, both in terms of diagnostics and in terms of therapeutics. When we talk about diagnostics, we are better equipped to diagnose, as I was mentioning some time back, to pinpoint that what are the exact chances that this disease will respond or not respond to XYZ treatment. So those tools are already available with us. For example, there are tests called next generation sequencing, NGS. Then there are whole genome sequencing that can pick up any mutation that is present in the body and that is supposedly the causative mutation for that type of blood cancer, whether it's leukemia, whether it's lymphoma, or it's myeloma. So the causative mutation, if you are knowing, so now we have got something called as targeted therapy. That means if I know the mutation, I know the product of that mutation, I can design a treatment that is specifically targeting that mutation. And that can lead to improving the outcomes. Not only this is only about the part of the treatment evolution. Targeted therapy, other than that, what is there is the bone marrow transplant.
Right.
So bone marrow transplant are now better than ever, in the sense the supportive treatment that is now available for the outcomes that are related to bone marrow transplant are much polished today as compared to what they were 30 years back. So first bone marrow transplant in the world was done in 1959 in US, of course. Professor Donald Thomas, who received the Nobel Prize in 1990 along with Professor John Murray. But yes, so that was the time when 8 out of 10 people who were undergoing bone marrow transplant used to die. Today, dying from a bone marrow transplant is progressively improving. I'm not saying there are no deaths related to bone marrow transplant, but 70% to 80% people can undergo a successful bone marrow transplant today, thanks to the not only the medicines that are available for the eradication of cancer, but also to the better understanding of the disease biology, to the better understanding of infections, diagnostic tests for infection, and molecular tests that have now become available, because that help us in strategizing the right treatment at the right time.
A patient knows about going for a bone marrow transplant if the patient has met a hematologist, then they know about the bone marrow transplant. But as a layman, as a general public, they don't know what bone marrow transplant is all about. When you use the word transplant, the people are afraid. So how do you tell people about, you gave us a history about what the bone marrow transplant is and how it has been evolved in the last few years and how it has helped the patients. But for a patient to know that what is bone marrow transplant, so how can you explain to a general public, a brief?
So I would say bone marrow transplant, first myth buster that I want to highlight here is bone marrow transplant is not a surgery.
Right.
It's a medical treatment. So no going into the operation theater, no use of knives. It is a medical treatment wherein the body's blood is utilized to do the treatment. That means the basic concept of bone marrow transplant is whenever we are doing an allogeneic transplant means taking the stem cells from the donor who is suitably HLA, human leukocyte antigen matched, and using those cells or body's immunity. For example, if you are my real brother and I take your stem cells that are HLA matched with me, your immune cells and the stem cells are going to take care of my cancer or my blood cancer. In the sense, your immunity will keep my blood cancer in check, and that is how I'll achieve a lifetime cure from my type of blood cancer, whatever XYZ it is. That is what is called as allogeneic transplant.
Right.
The other type of transplant is what called as autologous transplant. That means I utilize my own stem cells to cure or delay the progression of my cancer, my blood cancer. So there are different indications when we use an autologous transplant or an allogeneic transplant. Most of the times the autologous transplants, if we talk about cancerous conditions, they are used for lymphomas and multiple myelomas. When we talk about non-cancerous conditions, it is very commonly upcoming indication that it is being used for different types of autoimmune diseases. whether it's multiple sclerosis, whether it's systemic sclerosis. We recently completed transplant and discharged a patient with SLE, systemic lupus erythematosus. That's a type of autoimmune disease. So these type of patients who are refractory or not responding to medical treatment should undergo this type of treatment because that improves their quality of life, duration of disease control, and long-term survival. So from that perspective, autologous transplants have got some specific indications. Allogeneic transplants are used for more aggressive diseases and disorders, like most importantly, when we talk about cancerous conditions, they are used for different types of leukemias. Also, they are used for different types of non-cancerous conditions, the aplastic anemia, that means the bone marrow has stopped to function, different types of blood diseases called hemoglobinopathies, whether it is sickle cell anemia, whether it is thalassemia, or it is a primary immunodeficiency disorder. For these indications, what is used is an allogeneic bone marrow transplant. That means the donor stem cells are required to fight with the disease inside the patient.
We have seen in past, doctor, that sometimes the patient have a difficulty to get a match with the family, within the family. So what is the option for them?
So, delving more details into the science and biology of bone marrow transplants, as we talked about allogeneic transplant, the best case scenario is I have a full matching brother, sister. That is the best case scenario to undergo a transplant. Unfortunately, only 30% of the people will have a full matched brother or sister. So that means remaining 70% don't have a full matched donor available in their families. So what are the options for them? That's what we are talking about. So the options for them are, one, now there are registries across the world, more so country-specific registries where there is a donor pool. So supposing I am the patient, I have got actually a signature available in the form of a report. I send that signature to the XYZ registry, the national registry. They will search in their database that related and matching to that HLA signature of genetic signature of mine, whether there is a donor who can potentially donate stem cells to me because he is a full match donor with me, or he or she is a full match donor with me, and if he or she is willing to donate stem cells for a good cause, that can save my life. So there are registries. That's the second option that is available. If that is not there, we are fortunate that the science of haploidentical transplant, half-matched transplant, is evolving at a very rapid pace, and the outcomes have drastically improved over the last 20 years. So the third option, if you are my real brother and I and you are not actually completely matched, so we would definitely be half-matched. So a full match brother or sister followed by unrelated donor in the registry, and third is a half-matched donor, whether it's a brother or sister, or it's father or mother, or it is children of a person or a patient. Those people can donate the stem cells for the patient to undergo a bone marrow transplant.
Great. Now, another major issue which we see worldwide, within India and abroad too, is the patients suffering from sickle cell. So when we say sickle cell, so what exactly is sickle cell disease, and how do we diagnose it, and what are the treatment options available for them?
See, sickle cell is something that is increasingly getting close to my heart, I would say. Shockingly to me, the sickle cell, I think, is the most densely populated, or this genre of patients are most densely located in African subcontinent. But shockingly, the first papers, the first scientific evolution of sickle cell identification was done in US, which caters to only a lack of sickle cell patients. While in African subcontinent, the number of sickle patients would be 4 times, 5 times, 6 times as compared to that. But despite that, the major research, the major identification has evolved in American sort of continent. The blood cancers that we were discussing, they have got a 200, 300-year-old history. Sickle cell is relatively newer disease. It's just 100-year-old. You would be shocked to know that sickle cell was first published, the first paper was identified in 1910 in US. So it's just a 100-year-old disease. But yes, it's a significant, I really like to term it as a global epidemic with a population that is localized to certain regions within the globe. So, but yes, it is a global epidemic. The evolution of sickle cell has also been dramatic in the sense that see, the science has always evolved scientifically. That's the beauty. So as the people started identifying sickle cell, and the nomenclature of sickle cell was given to it in around 1920s, 1930s. After that, the first problem that was identified with sickle is almost all of them, those who were dying because of different type of pneumococcal infections. So then that was the time when Alexander Fleming had sort of discovered the penicillin as the antibiotic. So there was a trial that was done again in US of penicillin prophylaxis for patients who were suffering from sickle cell disease, and the death rate from this infection fell down multiple fold, and many people started to live longer with sickle cell disease. So that was the first successful intervention for people living with sickle cell disease. Then people understood or realized that by the age of 20 years, the people who are having sickle cell disease, almost 11% developed strokes inside the brain, and by the age of 45 years, the population developing strokes was increasing to 25 to 30%. So that was a huge number. What needs to be done? So there was a simple test, transcranial Doppler, that was used in intervention, not as an intervention, but to diagnose that those people who were having a transcranial Doppler velocity of more than 200 ml per hour were more prone to develop a stroke, and those were the target population to how do we prevent strokes in them. So those were the target population to design sort of research and trials in sickle cell anemia patients. Then came the actual treatments, and that was the HbF, hemoglobin F inducing. So scientifically, it was a very interesting finding that people and scientists understood that those patients of sickle cell anemia who had a relatively higher percentage of a specific type of hemoglobin called hemoglobin F, they had got a lesser chances of sickle cell complications, whether it is vaso-occlusive crisis, whether it is infection, whether it is strokes. So then came the sort of scientific evolution, that what do we do? That how do we, those people who are having a lesser quantity of hemoglobin F, how do we increase their hemoglobin F quantity so that the problems of sickle cell can be mitigated? So that was the time when azacitidine came into picture. Then hydroxyurea came into picture. A big time success of hydroxyurea now is something that is completely changing the landscape of treatment for hydroxyurea, even without a transplant. Then came the role of butyrates, arginine. So these are the agents that have been successfully used to reduce the complications that are associated with sickle cell. If you reduce the complication, it's not a disease. Of course, there have been many organizations that have contributed to this evolution. Red Cross has done immense contribution. It made us realize that yes, blood transfusions can be utilized to mitigate the side effects or the problems that are associated with sickle cell anemia. And yes, over the years, 1960s, 1970s was the time when the research on sickle cell was at its peak. And now when we talk, the transplant science has evolved. There is luspatercept that is available for its treatment. The bone marrow transplant has got a potential to completely eradicate sickle cell anemia. Yes, it comes with its own package of problems. The transplants are not 100% safe. Today also, it has got a 10% death possibility from different complications that are associated with sickle cell disease. But yes, just imagine 80 to 90% people getting cured of sickle cell disease that otherwise would be living in a sort of environment of fear, pain, anxiety, emotional stress. Those people can be salvaged successfully by a bone marrow transplant. A word not only about this, about future, I think what we're looking at recently, it's a time the FDA has approved for gene therapy in US, and recently the FDA has approved gene therapy in UK. So slowly and steadily, we are looking at a great potential treatments for sickle cell anemia in terms of gene therapy. We are expecting almost 90% success rates with almost zero complications associated with gene therapy for sickle cell anemia and thalassemia. So that's a big change. We are expecting it would reach us very soon, and that would be a game changer potentially for patients who are actually suffering from this type of deadly disease.
Right. So this is something a good news for the patient
Absolutely.
as well as for the doctors. who treat
Absolutely.
them. So it's a revolutionary changes in the medical science, which are eventually helping the patients to be
Absolutely.
cured well. So to sum it up, doctor, what message you wanted to give as a practitioner to patients suffering from blood cancers, any sort of blood cancer, and what are the options you feel are there in India which you and your team has been offering to them?
See, I'd be very vocal in sort of one observation, be it be Hollywood, be it be Bollywood, or be it be any national sort of the media houses.
Right.
The problem everywhere always has been cancer people in their movies always die. So that is the message that needs to change. We have to become positive. We have to convey a strong message that cancers or the people suffering from cancers were dying 100 years back. We are living in 2025. Cancer people suffering from different types of cancers are living a cancer-free life now. If not 100%, 60 to 70% people can be permanently cured of their blood cancers. And that is the reality. We see this, and that is why we are able to say that. And we preach that, that is why we are able to comment on that. So we have to give a very strong message to the society, and I think the media houses should play this. Cancer is curable. Cancer is not a death sentence. Cancer needs to be defeated, and that message has to be conveyed rightly to the public. That is the most important thing. When we talk about sickle cell, I think sickle cell is a disease we need to evolve. We are evolving. We have come a long way. But yes, there are better studies. It's a genetic disease. Sickle cell is a genetic disease. We need to understand that it can be permanently eradicated, just like polio got eradicated from the world or many developing countries. So similar to that, sickle cell can be eradicated from the world, and the world can be made sickle free. The strategies are required, the right platforms to discuss those things with the relevant stakeholders is what is required. With a proper strategic approach, pretty sure that yes, the world can be made sickle cell free.
So it's all about the perception is one of the reasons the people have a mindset seeing this all the movies and all this.
Absolutely.
They have a mindset. Blood cancer is something which end of your life
can be defeated. Yes, no doubt about it.
Right.
Maybe in one of your expert sessions, we would like to invite our patients who have been cured of blood cancers many years back.
Right.
So those are the people. Maybe the two of us cannot give the positive message, but the right people can give the right message. Okay, people saying that, oh, I had a blood cancer maybe 10 years back and now I'm fine.
And they believe
I'm doing scuba diving.
Oh,
in Maldives, I'm flying as a sort of a pilot for different airlines. So these are the people who give a positive message to the right people.
Doctor, as we discussed that this is one of the lifestyle diseases. So what kind of any changes in the food habits or anything which the patient should follow, which helps in their journey for treating for the blood cancers? And also, doctor, one important thing which I wanted to discuss with you is the problem of self-medication, which is getting very popular now. You see something on the Instagram, you see something on the website. You're not going to a doctor for a prescription. You're just trying to, take that medicines up and do a self-medication. I believe it also harms patients somewhere.
So two aspects I think you were trying to raise. The first is the self-medication. I'll give you a very small example. Today morning I went to a small pharmacy shop. There came a woman who asked, okay, my child is having cough and that is productive cough. Please give me some medication. The pharmacist was smart enough to give him 5 medications. He gave a syrup, he gave an antibiotic, he gave an antitussive, he gave a tablet for reducing the cough. So the pharmacist himself has not seen the patient. The woman walks into the pharmacy shop, blindly trusts that pharmacist, or I don't know who that person was, and takes the medicine and goes back. Where is the role of the doctor then? If the person has not seen the child, how critical is the child? What is the type of infection that the child is having? And blindly that child was given this medicine. Do you expect that that child will be cured? Unlikely. So this type of practices is something that have to be discouraged in our practice. There are right people who you should visit. There are pediatricians in your locality. Please visit to those local doctors in your vicinity. Get the patient checked, tested, identify the problem and approach it scientifically rather than roughly or rampantly going for any treatment that any person can sort of advise. Right. That is number one. Number two, coming to the role of diet, I usually try to refrain from this type of aspects. But yes, what I want to convey here is environment has got a role in developing or generation of cancers, including blood cancers. So the environment that we are living in a metropolitan city, and the amount of environmental toxins that we are getting on a daily basis, whether it is in the form of smoke, whether it's in the form of food toxins, whether it is in the form of stress, whether it's in the form of driving, whatever we talk about, we are living in a environment that is too toxic. Any person not to develop a cancer in this type of environment would be unusual. I can say this much. But fortunately or unfortunately, that's what the sort of industrialization has given to us as a gift, that this type of toxins we cannot avoid. Yes. So we have to bear with this. Can the dietary supplements take care of this? There are a lot of pharma involved in this sort of all this science and sort of pushing things to the next level, that yes, you take this can prevent your cancer, this can prevent generation of different types of cancer cells. But I don't want to fall into all that trap. The simple message is keep yourself healthy, do regular exercise, eat as much as organic food as possible, avoid junk food and avoid addicting substances. So these are the things, if we try to inculcate into us as a lifestyle, that can potentially have a negative oncogenic effect, or the effect can be negating on the cancer generation. So right, I would like to comment by saying this much only, that it's us that can help the burden of cancers to go down. There's an interesting study that 70% of cancers are preventable. Can you imagine that? Okay, 70% of the cancers are preventable. If that is the case scenario, it's we who have to take the action. If we are in the right frame of mind and right zone at the right time, we can prevent our cancers.
Now, doctor, we discussed everything. Now, something we'll discuss about you. Now, when we say about you is you got into a medical school, and how did you choose a specialty of the journey from a normal med student to a specialized hematologist? So how did you choose this segment, this line, and how did you evolve yourself as a person?
So I would say, again, the necessity leads to evolution. Personally speaking, if I say, the reason for me venturing into the cancer segment is I've seen cancers in the family, and that was a time when, of course, like we were discussing about it some time back, people who face cancers, they know the agony, the trauma the patient and the family undergoes during the entire phase. So any person who has seen cancer in the family can relate to those people. And I would say, specifically in my case, at some early age of evolution, I had misfortune to experience that in close family. And that was the time, at least, sort of motivation came that, okay, something needs to be done in this field. And that was the time when at least I decided, okay, I will move into this segment and do something, whatever is possible from my end, to contribute to the better outcomes of patients suffering from different types of cancers.
I hope you all liked the podcast, and we would like you to, if you like things, you please subscribe to our channel. You can contact us to the link below. All the details have been mentioned. And we hope we take you to a good journey and wish you a healthy life. Thank you.